Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to get any of your questions answered live, so please feel free to put those into the chat, as well as my chance to answer any of the questions that you have submitted onto the channel. Remember, not only are we on YouTube, we're also on Facebook and Instagram for additional content. So please feel free to share that with your friends and family. And also make sure you like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. And that's part of why I've been able to be a part of YouTube Health, is by having so many of you as part of my subscriber base. So I really appreciate all of you, and thank you so much for being here. And I'm going to get started with some of the questions that we have on the channel. And as you guys can see in the background, my kitty cat has joined us tonight. So we're going to start out. We had a lot of interesting questions this week from a lot of people. I'm going to start out with some bleeding questions that we got. We get a lot of bleeding questions every week. And that's probably because this is like one of the scariest things that can happen to you when you are pregnant. And so a lot of women want to get some reassurance as to what is going on because it is so scary. So we had some questions here. The first one says, I'm 4.5 weeks pregnant, and sometimes I have a very light brown discharge. I can also see one small streak of blood. Is this normal? It occurs every few days, and I have no pain or very mild cramps. So to begin with, bleeding during the first trimester can be very normal. However, we don't like to see regular bleeding like that, which is a little different of a presentation than we normally see. Brown is usually indicative of old blood, and we do have a video on the colors of blood, so we can link that into the description. But brown is usually indicating old blood, a bleeding that has resolved. However, when you're having blood that's coming on and off, this is usually an indication that something active is happening, even if the color appears like it's old blood. So you want to make sure that you are talking to your healthcare provider and letting them know what's going on so they can assess the situation. And what they're going to do is they may order some blood work, but they're primarily going to be looking to give you an ultrasound. And that ultrasound is going to check to see different things like the placenta and its position and other things. Now, the reason why I'm mentioning this is we actually had a question come in on my Placenta Previa video, which I think is kind of relevant to this discussion. And it said, I'm 14 weeks and 4 days pregnant. 2 days ago, I needed to go to the bathroom, but when I was done, there was a lot of blood and clots. I rushed to the ER and they told me they didn't know what caused it, even though the baby had a good heartbeat. And then during the sonogram, they said they couldn't find the placenta, but then they found it using a different method. Has anyone ever heard of this or been told this? I don't understand what could have happened. I had blood again and it stopped, but I'm now experiencing very light bleeding. Can somebody help? So one of the things that can happen that can cause bleeding is actually placental issues. So your placenta is the organ that's going to feed the baby. And that organ is full of veins. So it's a big kind of oval shaped organ, and it's got all these veins and blood vessels on this side, and it attaches to your uterine wall over here. And the two together, they form this base where we exchange all of our nutrients and oxygen and carbon dioxide back and forth between mom and baby. Now, what can happen is if there's any placental issues, those placental issues can cause some of that bleeding you see. And that can cause bleeding that comes and goes, which is why it's so important for us to figure out what's going on. If you are getting bleeding from the placenta, the ultrasound should be able to tell us that that's what's going on. And there are two different forms of bleeding from the placenta. The first is like an abruption. So a placental abruption is where the placenta actually starts to peel off the side of the uterine wall. This is a medical emergency. If you were in your second or third trimester and you're having a placental abruption, we're going to try to deliver the baby as soon as possible, because otherwise, as the placenta comes off, both mom and baby could actually die from a hemorrhage. The other type of placental issue is actually a subchorionic hemorrhage. So a subchorionic hemorrhage is like having a bruise underneath the placenta. So the placenta gets a little damaged and there's a pooling of blood, and sometimes that blood will leak out. But the placenta is still firmly in place, and there's plenty of other blood vessels that are working, that subchorionic hemorrhage usually isn't an issue for the pregnancy or the baby. Now, when you're having an ultrasound, it is possible, depending on the placental position and other things, that it may be hard to distinguish the placenta. And that's why different techniques are sometimes used, including a transvaginal ultrasound, where they actually use an ultrasound wand that's inserted into the vagina to help identify things. So that could be why that's the case. But these placental issues can also lead to some of this bleeding. Now, we had another question that said, I'm 6 months pregnant through IVF, which is in vitro fertilization. This morning, there was bleeding that started with fresh blood and clotting, along with mild period-like pain. But the ultrasound came back fine, showing 2 sacs with cardiac activity. However, I am still worried. Is it common to bleed in the second trimester? Okay. So it is not as common to bleed in the second trimester. So in the first trimester, generally speaking, most of the causes of bleeding are pretty mild. You can get sex can cause bleeding because the vaginal tissue is a lot finer and it can tear easily because of the hormones that are good for pregnancy actually dry out the tissue. You can have implantation bleeding. You can have a period that gets left over because sometimes your body doesn't realize it's pregnant right away. There's like all sorts of reasons. Once we get into the second trimester, though, it happens to be that it's a lot less likely that you're going to bleed. Usually, most of those things will have resolved themselves. So when we see bleeding, oftentimes the bleeding is due to you either going into labor and your actual cervix is dilating, or an infection, or sometimes the placental position. If you have a placenta previa, that can cause some of this bleeding if you're prematurely dilating. Now, that IVF question, there was one thing that stood out. It said 2 sacs. 2 sacs to me says twins, which is very common with IVF. A lot of times, more than one embryo is actually implanted to increase the chances of you getting pregnant. So if you have more than one implanted embryo, then you're more likely to have twins. So with twins, you'd have 2 sacs with 2 heartbeats. Now, if you're having 2 sacs and 2 placentas, which is one form of twin pregnancy, then you have placentas that are in 2 different spots in your uterus. Now, normally the placenta, if you have a uterus that kind of looks like this, the placenta is up on the side. This is your cervix. This is at the bottom, right? But if your placenta goes straight over top of the cervix, this is a placenta previa. Okay, this is a complete previa. This is a partial previa. This is a marginal previa. Okay, and what happens is when you, hey Jess, that's Figaro, aka figs. When you have a complete previa, what happens is if you start to dilate, remember I said this side of your placenta is full of blood vessels. If your cervix starts to dilate, some of the blood and clots could come out through the vagina. So that is possible that is what's going on. It's really hard to say. But it is something, again, that if you have any kind of bleeding, you want to make sure you're contacting your healthcare provider. Also, though, if you're having second or third trimester bleeding, guys, once your pregnancy gets to 23 to 24 weeks along, baby has a chance to live outside of the belly if given the right medications and if delivered in a hospital. So you don't want to take any chances. If you're not sure what's going on, call your doctor or come to the hospital so we can check you out. Now, let's see here. Our next question that we had, yeah, I'm going to go with this one. Okay, so we had a couple C-section questions. The first one is actually about a C-section incision. So she says, I'm 5 months postpartum. Is it normal to feel itchy on the skin below my C-section incision? I really don't want to scratch it, and there is an odor, but I don't see any open stitches. There's no pain. The incision seems fine, but the skin below is quite reddish. Okay, so the answer to this is no, this is not normal. You need to go get this looked at. Okay, I'm going to give you guys a personal experience. Okay, I had a little lump removed from my rib a couple years ago, and it was minor, but we were worried that it was vascular and it might have been something that was a big deal. So we had it removed in an operating room, and I was left with like a little 1-inch scar, nothing crazy. And they put in like glue over the top and 3 internal stitches. So you guys know most C-sections nowadays, they cut through multiple layers. So you have to cut through the outer skin, then you cut through a couple layers of like fat and muscle, then you get to the uterus, and the uterus then also gets cut. And when you're talking about the ability to have actually a VBAC, a vaginal birth after cesarean section, when they're talking about a horizontal incision, which is sideways, that incision that they're referring to is not the incision you see on the outside. It's actually the incision on your uterus. The outside can be horizontal crossways, but inside you can have a vertical up and down incision. And a vertical up and down incision means you cannot have a VBAC. So just so you guys know, you want to know what kind of incision is on the inside as well. Now, with these surgical procedures, on their way out, they sew you up, and they sew you up with dissolvable sutures. These are sterile surgical thread that is designed to dissolve in your body. No big deal. And then on the very outside, they use glue. The glue is usually purple. You're supposed to leave it alone, and then it'll just come off on its own in the shower. And sometimes they'll cover it with steri strips. So my incision was a little tiny incision. I had the glue and the steri strips. Within a day of my surgery, I got a really red, round lump just below that little cut. And it was very red and it was very itchy. And I said to them, I think something's wrong. It got very swollen, that it became very painful. And I went, they gave me some antibiotic cream. We were trying to figure it out. What actually happened was my body rejected one of the stitches. And so what ended up happening was the stitch migrated out through my skin and had to be removed. That was a weird, crazy, not normal thing. I've never seen that with a patient, but that's the kind of thing that sometimes can happen. After that, it was completely fine. For some reason, I had basically like a little tiny allergic reaction to one of the stitches. The other 2 were fine. I have no scar, nothing. You can't even tell that it happened. So with this C-section question that we got, when you're having that kind of reaction where it's red, there's an odor, and it's itchy, that's telling me something is going on. You're 5 months postpartum. It shouldn't look or act like that. So you want to go get it checked out. It's possible you're having allergic reaction to some of the stitches. It's possible you've developed some kind of cellulitis that needs antibiotics. But the most important thing is you do get it checked out, because it is very important that we get it fixed before something worse could happen. You could get permanent tissue damage if you don't get that looked at. So you want to make sure you go get that checked out. But no, that is not a normal postpartum experience with an incision. Next cesarean section question. I have a 2-year-old, and I will need to have a C-section by myself because my support person will be looking after him. Is it okay to have a C-section alone? So it is okay to have a C-section alone. It is actually, unfortunately, very common that lots of moms will have to have their surgeries by themselves. You can actually talk to the provider team and see if somebody can hold your cell phone so that your partner can actually see the baby be born. Some hospitals will allow that, some won't. You can also try and see if you are able to possibly have somebody watch your child right at the very end, like maybe a neighbor sits with the baby in the car just long enough for your partner to be up there. I mean, you can try to be creative. Unfortunately, small children cannot be in the hospital. It's not safe. There's too many things going on. And of course, the staff cannot watch your child for you. A lot of families get very upset by this. They feel very put off, or like staff doesn't care when we say that children can't be present. But I think COVID-19 gave the whole world a really good example of why we need to be very careful. There's lots of different diseases out there besides COVID-19 that can be in the hospital. And you don't want to have little children around when you don't know exactly what's coming in. Additionally, it's really hard to pay attention to everything that's going on and a toddler. So that's why we ask that kids stay at home. So when you're having a C-section by yourself, the staff will do whatever they can do to make your stay as comfortable as possible. We really try hard. The biggest thing that you have to worry about really is just making sure that you have a ride to go home and that you have the car seat for the baby. Okay. Anybody who's joining us, I'm Dr. Samantha, the maternity mentor. Welcome. Please feel free to put any of your questions into the chat. So we had a question on my drying up breast milk video, and it said, I have had an abortion and I'm experiencing breast engorgement. It's swollen and I'm in pain. So I wanted to address this question for a couple reasons. The first thing is the word abortion. I wanted to normalize that word. We oftentimes hear that word and assume a lot of things from it. So that everybody knows, the word abortion is actually a medical term that we also use that encompasses miscarriage. An abortion simply means a pregnancy has come to an end, and that's how you should look at it and nothing more. Once a pregnancy has come to an end, there is the chance that you will develop milk. And when that milk comes in, we need to try to dry it up right away. The best thing to do is to do the stuff that's in the video. Benadryl and Sudafed can help to dry you out. Peppermint is really good for drying out your milk supply. You can also do sage tea or parsley. It's really, really, really kind of yucky tasting, but it works. Don't bind your breasts. Binding your breasts is actually really bad for you and can cause some like it can cause you to get mastitis and other things. Ice, cabbage leaves, those are also very good things. Okay. Alrighty then. Please feel free to put any of your questions into the chat. I am going to go on to a question that came in about gestational diabetes. So this one said, doesn't fruit have sugar? Why is it okay to eat sugar or to eat fruit? Sorry. Okay, so I love this question for so many reasons. So let's start. To be very honest, it's not okay. You shouldn't be eating fruit when you have gestational diabetes. Now, I can understand why some people would be confused. I remember when I would be in the hospital with patients and I would see their diabetic trays. Okay, so these are patients identified as having diabetes, identified as needing a lower calorie diet because of their diabetes, and they'd get pancakes and they'd get orange slices and all this stuff that was just full of sugar. If you have diabetes, you should not be eating sugar. That includes fruit. That's why you can't drink cranberry juice to prevent urinary tract infections. Heard the word prevent, guys, not treat. Cranberry juice does not treat. But you can't drink cranberry juice to prevent urinary tract infections if you have diabetes, because even the most natural cranberry juice is full of sugar. So it is not okay to be eating fruit. That's not healthy for you with diabetes. If you were going to be eating fruit, you should be sticking to stuff, basically the berries, the berry family, blackberries, raspberries, blueberries, strawberries, those are all the lowest carbohydrate content with the highest fat highest fiber for all of the like fruits. Those are the best when you're talking about somebody with gestational diabetes. But really, you don't want to be having a lot of fruit when you are gestational diabetic. In fact, you want to stick closer to like a ketogenic diet, which is high protein, high healthy fats, and low carbohydrates, aka low to no fruit. So don't eat fruit, guys. It's not good for you. And actually, just so you guys know, one of the other things that's out there, when you are pregnant, you have to be really careful with fruit also as like a safety thing. There's a lot of places where you can go and get fresh juices, like fresh squeezed juice that are not pasteurized, like they're literally being juiced right there. You actually have to avoid that during pregnancy because you're immunocompromised and you can actually get food poisoning from those. So you want to be careful with that. Okay. Okay, so moving on. Had a question on my sex video. Can I have sex during early pregnancy? So, yes, you can. Unless you've been told by your healthcare provider that you are not supposed to be having sex, you can absolutely have sex while you are pregnant. There is nothing to say that it is bad for you. Furthermore, you can actually have sex all different types of ways. So some women are put on pelvic rest, which means nothing in the vagina. That means no sex, no tampons, no fingers, no toys, nothing. But that doesn't mean you can't have an orgasm. So when you're talking about sex, guys, it's really important that you guys have a very vocal conversation with your healthcare provider about what does that mean, because sex can look very differently for a lot of different people. Additionally, for example, you might not be able to have vaginal sex, but you might be able to have anal sex. And so it's important that that you're asking these questions, they know, your provider knows your health history. They know if you're having multiple babies, like twins or triplets. They know whether you have an incompetent cervix. They know your history of infection. And they're able to give you better guidance. But ultimately, generally speaking, you're allowed to do everything you used to do before sexually. Now, a couple guidelines. If you are actively using toys, you want to make sure those toys are washed well, okay? Because you are at a higher risk of developing an infection during pregnancy. And a vaginal infection could put you at risk for preterm birth, stillbirth, and stuff like that. So you want to make sure you can clean your toys well, or they are made of a material that is easily cleaned. At the same time, you don't want to be using any harsh cleaners that might cause vaginal irritation, because that could lead to some of that spotting that we see in the first trimester. And then you want to make sure you're using good hygiene. Many women know that it's really good practice to pee before, but definitely after you have sex, because when you pee after sex, you help clear out any bacteria that might have gone up into the urethra, which could cause a urinary tract infection. When you're pregnant, it is extremely important that you do this, because urinary tract infections can lead to preterm birth, miscarriage, and stillbirth. Okay? So very, very, very important. And then the only other thing I will tell you, which will kind of lead into our next question, is you want to make sure you're having safe sex. So if you have multiple partners, make sure that you're using condoms or other forms of protection while you're pregnant if you are not sure about their status. So my next question is about sexually transmitted diseases. And it says, I've been trying to conceive for 1 year and I still haven't gotten a positive pregnancy test. I recently found out I have chlamydia and I wanted to ask if this was the reason I'm not getting pregnant. I am on medication now. And the second question is, would I be able to conceive after the infection is cleared? So, chlamydia is one of many sexually transmitted diseases that are out there. Chlamydia is particularly devastating. And the reason why chlamydia is particularly devastating is because chlamydia actually can cause something called pelvic inflammatory disease. Pelvic inflammatory disease can cause scarring of the uterus and fallopian tubes, and the scarring in the fallopian tubes can make it impossible for eggs to leave the ovary and travel down into the uterus. Additionally, it makes it impossible for the sperm to travel up into the fallopian tube to meet the egg and fertilize to create a baby. So, because of pelvic inflammatory disease, there's a lot of rates of infertility. And so unfortunately, chlamydia can be cause a silent infection. A lot of women with chlamydia will not have any symptoms, and therefore they don't even realize it's going on. And by the time they realize, it's too late and the damage has been done, and they have scarring of the fallopian tubes. So what you want to do is, yes, once you get the infection cleared using the treatment, you might be able to get pregnant. However, you want to go to an infertility specialist. They can do a special procedure where they will actually inject dye and see if your fallopian tubes are blocked. If they are not blocked, then you should be able to conceive naturally. If they are blocked, they'll be able to tell you about your options. Now, if you have chlamydia, it's important that your partner get treated as well, because otherwise you guys can pass the infection back and forth to each other. And so then it's a never-ending cycle. So both people have to be treated at the same time, and then you have to make sure that nobody is having unsafe sex again. Okay? Welcome. I am Dr. Samantha, the maternity mentor. Thank you so much for joining me on this Monday evening. Please feel free to put any of your questions into the chat. We're going on to sleep. So this was the question. My wife was normal after the birth of our second baby, but after 15 to 16 days, my wife went unconscious. So we went to the gynecologist and the psychiatrist. She is getting abnormal sleep almost 16 to 17 hours, and she is feeling headaches and intoxicated. What should we do? So this was a question that came in, and it's a little choppy because I think the person does not speak English as a first language, but I am going to try to get through pieces of this. So 15 to 16 days postpartum is where we go from what would be considered postpartum blues to postpartum depression potentially. And one of the main symptoms of depression in general is sleep issues. It's either insomnia, you don't sleep, or hypersomnia, you sleep too much. It can also be represented as as somatic symptoms. So somatic symptoms include headaches, okay? Headaches, stomach ache, backache, nausea. Those are all these generic benign symptoms that could be caused by any number of things. And that's one of them. And then feeling intoxicated, I'm going to assume they mean dizziness, but I'm not positive. So what needs to happen? I will tell you that what you need to do is your wife needs to be checked out by a neurologist, okay? If this is depression, the psychiatrist should be able to provide an antidepressant that might be able to help with mood. But if this is actually something else, headaches and intoxication, like an intoxicated type of feeling, tells me might be something neurological, and you need to have a neurologist do a scan of the brain and ask your wife some questions to determine if there's anything there. The next question I got was, is the very occasional use of zolpidem safe? I'm 19 weeks pregnant and have occasional sleepless nights. I know the drug is Class C, but I'm wondering if there's any studies on this drug that you could share. I truly appreciate your answer, which I love to hear. That's very nice. Okay, so I am pulling up my handy dandy drug guide. So when you guys ask me anybody who's new to the channel, this is something you should know. A lot of people ask me drug questions all the time. Is this safe? Is that safe? First of all, always ask questions. It's very important. You should always know for sure what you're putting in your body, and your healthcare provider, when they are talking to you about medications, should do risk versus benefit. I do this day in and day out. There are times where I really want a patient to try a med, but I always have to tell them the risks, even if I know that means they're going to say no. My job is to try to also tell them the benefits and why I think something is good for them. But ultimately, you have the right to know both sides of the story so you can make an informed decision. So if you guys aren't sure why you're being prescribed something, ask for both sides. Now, sometimes we are offered a treatment, a medication, a test to do, and we're really not sure. So that's when sometimes we will seek a second opinion. Second opinions are also very valid. Now, this can come in a variety of different places. It can come from seeing another doctor. It can come from talking to a friend where you're like, your friend's like a nurse or a doctor, and you're just like, hey, this is what my doctor said. And your friend, the doctor, says, yeah, that sounds like a normal thing. But when you're talking about medication, you can also actually go to your local pharmacist. Pharmacists have access to databases and specialized training that help them understand the safety of the medications and interactions with medications. They also have to understand what's safe for a pregnant woman. So, pharmacists get access to a lot of different things that the regular person might not have. In addition, people like me also have access to resources. Now, one of the resources I like to use is by Thomas Hale. Thomas Hale runs the Infant Risk Hotline, and he's basically developed a scaling system for the safety of medications for both pregnancy and lactation. And what he does is he aggregates molecule size and fat solubility and half-life and the side effects and safety profile we know for adults and animal studies and all this stuff. And he puts together and creates this risk scale. Unfortunately, we cannot test medications on pregnant women or breastfeeding women. It's not ethical. So all we can do is gather this other data. So when you're talking about, so this is what I'm looking at, okay, directly from this book. So it says that there aren't any studies to link it with birth defects. However, you should only use it when absolutely necessary. Certain benzodiazepines have been linked to birth defects when taken during pregnancy. So while this one has not, others in the class have been linked to birth defects, okay? So this medication, zolpidem, could do the same thing. Additionally, sleeping pills taken in the last weeks of pregnancy have been known to sedate the baby. Therefore, avoid using this medication during pregnancy. That's what it says. And it says, avoid using this medication during pregnancy in big, bold letters. Okay, zolpidem is not a medication that I prescribe. It is part of a class of, and I prescribe meds for insomnia all the time. It is part of a class of medications that I avoid basically like the plague. It is a hypnotic. Hypnotics also include Belsomra and Ambien. Ambien is the number one most popular. Hypnotics can actually cause you to do things while you're asleep. So people have been known on Ambien to drive cars and wake up in other places because they were asleep the entire time, but they did not know it. So I would not be prescribing this to any of my patients at all, especially when there's so many other medications you can take. So many others, okay? You can take melatonin. I know what you guys will say. You've read this and that on the internet. You can take melatonin. You can take Benadryl. You could take Seroquel. You can basically take any of the antipsychotics. You can take, oh my gosh, magnesium. You could even get into some of the other offshoot supplements. I mean, there's so many things to choose from. The gabapentin is another one coming to mind. I would absolutely not be taking this medication. So I hope that answered your question. On my swelling video, I got a question that said, is it safe to use Epsom salts for swollen legs? And the answer is yes. So Epsom salts are basically magnesium. A lot of times people will put those into their bath water and then they soak in it, and that soaks into the muscles, and magnesium is a smooth muscle relaxant. So it really helps those sore muscles. So you can do that. Whether it'll help with your swollen legs, not sure, but it's still fine to try. However, what you do want to know is that you have to be very careful about how hot your water is. Pregnant women should not be sitting in too hot of water, and you need to make sure that you are only staying in the bath for a short period of time. Okay. I'm coming to the end of the questions you guys have submitted to me. So if any of you guys have questions, please put them into the chat. We had a question on my yeast infection video. Is it okay to have intercourse during a yeast infection? I'm going to go with the answer is yes. Most women probably wouldn't be advised to, because you would want to receive your yeast infection like treatment and be clear to the yeast infection, because you don't want to introduce any bacteria into there. But technically, that's a recommendation, not a requirement. But I would say it's probably best to just get treated first. So, you can ask your OBGYN, but I would say just go get treated. It takes like 3 or 4 days, and then it'll be done and you can go back to having sex. Same kind of line on my vaginal discharge video. I had, what about thick and pink discharge with a smell? It's just 2 days before my period. If you guys have any thick discharge, generally speaking, thick discharge, in my opinion, is a warning sign. At that point in time, you need to go to your healthcare provider so we can go ahead and assess you. And what we're going to do is we're going to swab the vagina, and we're going to swab some of that discharge, and we're going to send it to a lab and see what we're looking at. Okay. So it could be that it is like yeast or a fungal infection or a bacterial infection, but thick is not normally what we see for discharge out of the vagina. So you do want to get that checked out. When you're looking at pink, pink seems to me like some kind of bleeding, and bleeding can be a sign of infection. Okay, last question, guys. And then if you guys don't have any questions, I guess we're ending early tonight. This one is on my Ureaplasma video. It says, now I have this kind of bacteria, and unfortunately I must protect myself. Originally, how can you give advice? So I think what this person is asking is, what is the treatment for ureaplasma? It's antibiotics. There are certain types of antibiotics that you take to treat a ureaplasma infection. Very important to treat ureaplasma. It can cause complications with the pregnancy. It can also cause some issues with infertility if it's left untreated. Ureaplasma is something that gets passed back and forth amongst partners. So both of you need to get treated. It's not just one of you. If both of you are not treated at the same time, then it can just go back and forth and back and forth. So you want to make sure both of you get antibiotics, and then you need to wait for 21 days and get retested. You cannot be having sex in the meantime, because you need to make sure you've cleared the infection. Otherwise, it'll just keep going on. So, guys, I have finished early. Any of you guys have any questions for me, please feel free to put them into the chat. I am over on Facebook and Instagram for additional content, so please make sure you check me out over there. Like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator. Share the channel with friends, family, neighbors, coworkers, anybody you can think of. We are part of YouTube Health Platform, which means YouTube took the time to look at my channel, look at my content, and check me out. They made sure I am actually a nurse practitioner, that I actually have a degree from a legitimate university, and that I actually hold an actual state license that says that I'm a nurse practitioner. So when you see content creators that are a part of YouTube Health, you can be assured that we've gone through a process that YouTube has verified us as good providers. And then, just keep telling me what you guys want to see. We always look at your comments. We always look at your questions, and we really try to put out content that you would like. So with that being said, it looks like we're going to end early this fine. I appreciate all of you guys. Have a wonderful evening. I'm Dr. Samantha, the maternity mentor. Bye for now.